Hi, this is a video to demonstrate how to change the caps on a PICC line. Now we have here an open-ended double lumen PICC line, and we're going to change the caps. Caps are changed usually when you change the dressing once a week, or if you're having difficulty aspirating blood, or if you see the caps are dirty, or of course if there's any problems with flushing, or if they're leaking or cracked or anything like that. The supplies you're going to need will be your caps. You'll need two. If you're changing caps, you're going to change caps on both lumens. So we have two of those. We also have pre-filled saline flushes. We have two 10cc pre-filled saline flushes. We also have swabs, SoluPrep swabs. We also have drawn up already in the med room two 10cc hepaline flushes. Sorry, not 10cc. They're in a 10cc syringe because you are dealing with a PICC line. You must use a 10cc syringe. If you use a syringe that's smaller, that's too much PSI and you can put a hole in your PICC line. But this is 3 mils or 3 cc's of hepaline, which is your 100 unit per mil heparin solution. So we have 300 units of hepaline per lumen, and we have those labeled and ready to go. You're going to do hand hygiene and position your patient. Then we want to put on clean gloves. Now, because we are going to change the caps, we are going to be opening the system to air. So it is very important that we make sure that the clamps are closed before we take off the cap and open it up the system. So you want to be very careful with that. We also want to wear a mask. You're going to wear a mask in order to prevent any bacteria or any kind of germs or anything from your breathing going into the patient. And hopefully you can still hear me when I have this on. And so you're going to tie your mask, make sure your blue is on the outside and your piece of metal is along there, and it goes underneath your chin. And if your patient is coughing or has some kind of bacteria or problem, infection in their sputum, you'd want them to wear a mask as well, but at least have them look away. And so you're going to first of all start by opening your 10cc flush. You want to maintain a sterile, no-touch technique. And you want to prime your cap first because your cap is full of air, obviously, so we need to prime that first. So the first thing we're going to do is take the air out of the 10cc syringe, and then we're going to carefully open the package of your cap. When you take it out, you will see that it looks like this. The blue part is going to come off, and that's going to be attached to the actual PICC line. And the other part is where you are going to flush it with your swab. With your saline, where you're going to prime it. It's very difficult to get out of the package without touching, so we are going to scrub the hub for 15 seconds. Okay, so we're scrubbing not the blue part, but the other part, because that's going to connect to your syringe. Then you're going to put those two together, pushing and twisting clockwise. Okay, then you are going to flush the air out. Okay, and now you have this ready. You need to put it down, but you don't want to put it down and contaminate it. So you may use your package that you opened and carefully place it in there so you can put it down. And you now want to have the patient hold their breath if possible. Not quite yet, but that's coming up. And you want to get your swab, and you want to pick a lumen. It doesn't matter which one you start with. You want to make sure that the clamp is closed, and you want to take the cap off by twisting. And once the cap is off, you want to wrap your swab around it And the patient's holding their breath as soon as you took the cap off, and you want to scrub for 15 seconds. We'll say that's 15 seconds. Then you're going to take out your cap. You're going to carefully take the blue part off, and you're going to put these together by pushing and twisting clockwise. Okay. Then you are going to open the clamp, and you're going to pull back to take any air that possibly got trapped in there out of the patient, and also you want to see blood in your lumen, okay, to verify placement. So then we're going to give it a quick tap to bring all the air to the top. We're going to flip it up, and we're going to do a pulsing pressure flush. Okay, and you're going to give your full flush of 10 cc's of saline. And right before we get to the end, we're going to close off the cap as we push the plunger with the other hand. Right there. I'm going to leave that connected so I know that I've changed the cap and flushed that one. Then I'm going to do the exact same thing to the other lumen. I'm going to open up my syringe of saline. I'm going to get rid of the air. I'm going to open up my cap. Carefully take it out of the package, trying not to touch the end. Okay. Then I'm going to open a new swab, and I'm going to swab the end of the cap. That's going to be attached to the syringe, 15 seconds. You're going to take the cap off the syringe, and you're going to push them together clockwise. Okay. And then you're going to prime that one. And again, we're going to put it down into our package so it is not contaminated. Then with our other cap, we're going to make sure again the clamp is closed so we don't let air into the patient. We are going to take a new swab, and we're going to take the cap off, have the patient hold their breath. Cap comes off. Oh, this one's stuck. Oh, it's really stuck. Oh, it's really stuck. Oh, there we go. Okay. And you'll have your new swab, and you'll wrap it around, and you'll scrub 15 seconds. And we'll pretend that's 15 seconds there. You will take your new cap, you'll take the blue part off, and you will put these together by twisting clockwise. And again, you want to give it a little snap in case there's any air. Open your clamp. And of course, the new cap is on. The patient doesn't have to hold their breath after that. And you're going to pull back in case there's any air trapped in there, and certainly to see blood. And then you're ready to flush. Flip it up. Give it a little snap in case there's any bubbles. And you're going to pulse pressure flush. Okay. Now, because we are dealing, again, with an open-ended PICC line, which means it does not have a one-way valve inside that prevents backflow of blood and clot formation, then we need to heparinize both lumens at the end of the procedure. So we're going to close the clamp and push the plunger at the same time. And then we're going to do our heparin. So again, it doesn't matter which one we do first. We're going to take our needle off the heparin that we drew up, and we're going to open a new swab. We're going to take the syringe of saline off, and again we're going to wrap the swab and scrub the hub for 15 seconds. We'll say that's 15 seconds. We're going to connect our heparin. We're going to open the clamp. No need to pull back now. We verified placement, and we don't want to bring all that blood back that we just flushed into the patient. So now we simply heparinize by doing a pulse pressure flush of our 300 units of heparin. Okay. And once you've heparinized one side, and you can go ahead and heparinize the other side. Make sure your clamp is closed, take your old saline off, wrap it in a swab, 15 seconds, needle comes off your heparin, push and twist, open up your clamp, and simply flush. Right before the end, close the clamp, push the plunger. There we go. And we would take off our heparin syringes. Make sure your clamps are nice and tight before you leave the patient. And that is it. You have now changed the caps. Okay. And just take off my mask and my gloves and do hand hygiene. And that is it. Now I would proceed to do my dressing change. And it makes no difference whether you flush it and change the caps first or whether you do your dressing change first. Personally, I would do the flush first, because if there is a problem with your PICC line and the problem couldn't be fixed, perhaps we'd have to pull the PICC line today, so it only makes sense to me personally to do the flush and the cap change first. And if you have any questions about changing the PICC line caps, please contact me, and the next video will be to show you how to do a PICC line dressing change. Thank you.